So part of the issue is that the number of opioid-related overdoses has been on the increase in British Columbia since around 2010, 2011, but really increased around 2015, and the public health emergency was declared in April of 2016. And so the class of medications that we're generally talking about are called opioids, which are a class of medication, originally started as prescription medications to treat pain, post-surgical pain, cancer pain, etc. And there are many different forms of these medications, such as hydrocodone, oxycodone, fentanyl, and morphine. And what happened over the years is that there was some diversion of prescription medications to illicit use, and then there was also manufacturing of more synthetic and more potent opioids that became quite dangerous when people started to use them in the way that people were using them. So much higher potency and relates to an increased risk of overdose events and deaths. So that's really kind of how the opioid crisis started. And as we've seen, the drug supply has become increasingly more toxic over the years. When the public health emergency was declared, the First Nations Health Authority began to create a framework to respond to the opioid crisis that was guided by reciprocal accountability and underpinned by our teachings and cultural safety. So the 4 pillars of the framework include preventing people who overdose from dying, keeping people safe when using, creating an accessible range of harm reduction and treatment options, and then supporting people on their healing journeys. So there were a whole range of services, programs, interventions that First Nations Health Authority has led for BC First Nations people who are involved with opioid use.
I would just say that, First Nations Health Authority has also been like a really good leader across the province in overdose response, because typically, harm reduction implementation has been under 2 lenses. One is political, in that, we save money in the healthcare system that we would spend in healthcare if we didn't have harm reduction. And then, of course, in a very population public health lens, harm reduction improves the quality of life and saves lives. But First Nations Health Authority, I think, in my experience of the last, since the public health emergency was declared, really started to implement community level, accessible means of information sharing by having town halls, community-based workshops for take-home naloxone training, nasal naloxone training, and then now developing a naloxone network where communities across the province can engage with one another and share promising practices for community-based, nation-driven overdose response efforts.
Part of the challenge that we all face in British Columbia is we're operating under 2 concurrent public health emergencies, that of the COVID-19 pandemic and the opioid crisis. And as Len mentioned, one of the most tragic unintended consequences of the public health measures that have been put in place and recommended have resulted in things such as people using alone. But the other factor was initially during the first several months of the strictest lockdown and the gradual opening up was some of the services that provide harm reduction and treatment were, either closed for a period of time or significantly reduced their hours or accessibility. And it made it much more challenging for people who use substances to access those services. And of course, what we saw was a significant rise in overdose events and deaths for all British Columbians, but particularly First Nations people.